Hello, thank you for joining me for this presentation of the underlying issues of medical marijuana. I'd like you to take a look at this picture. This is a picture of Shawnee. Shawnee is very upset, as you can see. The reason for Shawnee's disgruntled attitude is because her 11-month-old son has just been taken away by Child Protective Services. The reason? Shawnee and her boyfriend both use marijuana for medicinal purposes. Shawnee has been diagnosed with chronic pain and depression, and her boyfriend is diagnosed with chronic pain and anxiety. They never thought that their use of marijuana would affect the well-being of their child in their home. They didn't understand why the police came to take her boyfriend away and while Child Protective Services came to take their son. Medical marijuana is defined as the whole unprocessed plant that's used to treat the symptoms of diseases. It doesn't necessarily heal diseases, but it's often used to mask the pain associated with sicknesses and diseases like MS, Crohn's disease, HIV, AIDS, cancer, and many others. While this drug and this method of treatment is prevalent among the United States, it's not approved by the FDA. Because of the clinical studies and trials that are a part of proving a medicine to be useful, the FDA can't approve it yet. Short-term symptoms for using marijuana include dizziness, shallow breathing, red eyes, dry mouth, and increased appetite. These symptoms usually last 1 to 3 hours. The quickest way to get marijuana into your system is to smoke it. Long-term effects from using marijuana for medicinal or recreational purposes are many. We'll first discuss the breathing problems that's associated with marijuana. Oftentimes, the same effects that tobacco users suffer with, the coughing, that dry hacking cough, and the chest problems, medical marijuana also causes these same issues. You're also at an increased risk of heart attack because marijuana smoke increases your heart rate and puts you at an increased risk for heart attack. If you have trouble or issues with diabetes, low blood pressure, or liver disease, marijuana worsens the effects of these conditions. In men, low testosterone and sperm count is a side effect of smoking marijuana. Mental health, while it doesn't cause these conditions, it worsens the symptoms if you already have these problems. So far, we've discussed the short-term and long-term effects of using marijuana to medicate. I'd like to present to you now 6 steps to take, alternative treatment plans to use to solve the issues that you may have with your body. The first thing I'd like to discuss is believing in yourself. Doctors all over the world have proven for more than 50 years that positive belief and affirmations make a difference in your well-being. If you say to yourself that you are healed, you will be. Just like if you say you're sick or you're in pain, you will experience those things. You have what you say. So if you speak health and wholeness into your body, you will experience those things. The second thing I'd like to bring up is finding the right support system. It's important to surround yourself with people who are acting, speaking, and believing with you. You don't want to be with people speaking negative thoughts. You don't need poison put into your body but you need health and healing spoken into yourself. The third thing I'd like to say is that you should listen to your body. Our bodies know, and we know, our intuition tells us when something is wrong quicker than the doctor can. Listen to your body when it's speaking to you. If you're feeling sick, short pains, listen to your body. Stop, take note of what's going on within you. After you've done that, you'll move on to the fourth step. That is diagnose the root cause of your issues. A lot of times, if you're in a bad relationship, if you're in a bad job, you're in a bad place in life, you're eating the wrong foods, you're drinking the wrong items, these things affect the well-being of your body. That drives us to our fifth point, which is write a prescription for yourself. We have to change the things that are causing adverse reactions with our body. That may mean getting out of a negative relationship, getting out of debt, leaving a dead-end job. You may have to incorporate exercise into your diet, change what you're drinking. Finally, if you've done all the things that I've suggested, if you're believing in yourself, if you found the right support system, if you're listening to your body, if you've diagnosed the root cause, and if you've written a prescription to help change the things, to right all the wrongs, and you're still having issues, then I suggest that maybe your problem isn't physical or it isn't mental, but it's spiritual. So I implore you to take time out, break away from the television, the radio, the TV, the naysayers, the doctors, and look within, search within yourself, in your spirit, to see what you need to become whole and better. As we have learned, the underlying issues of medical marijuana are many. Puffing and passing is not an option. As we think ourselves whole and well and healthy, we will be. When we purpose in our hearts to be better and do better, the sickness and diseases will leave our bodies. They will pass away without us puffing.